Hi, this is Lindsay, and we're back at Bone and Joint Institute with our monthly Facebook Live series. And this month we have Dr. Casey Davidson with us, and he's talking about when you have back and hip pain, your front pocket versus your back pocket. Now, don't be confused by that. He'll do a great job of explaining that, but we're going to kind of get into back pain and kind of what that means here. But first, Dr. Davidson, give a little intro on yourself and tell us about the spine program here at Bone and Joint Institute.
Sure. Yes, I'm Casey Davidson. I'm one of the orthopedic spine surgeons here at the Bone and Joint Institute, and we have 3 spine surgeons here at the Bone and Joint Institute, and one other spine provider, Dr. Zach Cobb, who also helps us with our non-surgical spine management. And so we really have an all-encompassing care in regards to the spine, and basically try to accomplish, improvement in pain, improvement in functionality via a number of different avenues and a number of different assets and different treatment plans that we can utilize.
Individualized to the patient,
right.
each and every one, absolutely. Well, many people experience low back pain, hip pain, and they can often be related. So when you see a patient, how do you differentiate between the two?
Sure. And so a lot of what we do, and as an oversimplification, a lot of times what we'll say is if you're having front pocket pain, or if you can imagine you're wearing a pair of pants that has front and back pockets, front pocket pain is usually something that's coming from the actual hip joint itself, and so anything radiating into the hip or the groin area is more likely to be coming from your hip joint socket, either some arthritis or some irritation there. If we describe it and if you call in, a lot of times the scheduler will ask you, are you having pain in the back pocket? And usually in the back pocket or buttock area or radiating down the leg is coming from the back and can be something like a pinched nerve.
So what treatments or what do you do if someone's experiencing that front pocket or that potential hip pain?
Sure, and so a lot of the times what we'll do, and we have different providers that provide and that take care of different parts of the body, and so radiating pain in the front pocket or into the groin area, we'd want to get you over to see one of our hip surgeons or orthopedic surgeons that take care of hips, as they'd be able to kind of help treat that and initiate treatment on that.
And then on the flip side, what about the back pocket? Kind of as a spine surgeon and physician, what do you do about that back pocket?
Sure. The back pocket is something that would need to get over to one of our spine providers. And like I said before, we've got 4 spine providers that see new patients that are physicians, but we've also got physician extenders. So we've got 3 physician assistants that currently can help initiate the treatment of that back pocket pain. And when you're having the nerve pain down the leg, it can be pretty miserable. And so we've got a lot of different things, medications and therapy and different things that we can do to treat it and make it, get it feeling better.
Okay. Well, do you have to do any type of imaging, such as X-rays or MRI? Like, how does that work with front pocket, back pocket?
Typically, we will obtain some X-rays when you get here, and what that allows us to do is to look at the bones and look at the discs and look at both the hips and the back in order to assess, are there any structural abnormalities? Is there any arthritis? Are there degenerative changes that may be contributing to some of that pain? And so that's usually where we start, is with some X-rays.
Okay. And then for that back pocket pain, you mentioned therapy and maybe some medications. Can you go into a little bit more detail of what that treatment plan may look like?
Sure. And so usually what we'll start with, and depending on some of the symptoms, depending on some of the factors and other medical comorbidities that may be present, we will usually start with some physical therapy. Physical therapy has a lot of great literature to support it in taking care of both back pain and nerve pain down into the leg, and so we'll usually initiate that at your first visit. In order to manage some of the discomfort related to the irritation of the nerve root, some of the inflammation, sometimes we'll prescribe things such as anti-inflammatories, so some NSAIDs, some Tylenol. Sometimes we'll utilize some muscle relaxers if we need to for muscle spasm pain, and sometimes we'll use some short course of some steroids, which are a strong anti-inflammatory. We really try to minimize narcotics if we can, as they've been shown to be problematic and can cause a plethora of other issues. Occasionally they can be beneficial, and we'll utilize them sparingly, but those usually are kind of medicines, that is, are utilized to kind of help manage some of the discomfort, to allow you to start moving and doing some of that physical therapy.
Awesome. Awesome. Well, talk a little bit about the technology and the kind of some of the new things that are kind of coming down the pike as far as our spine program here.
Sure. So a couple of different exciting things that we've got going on. One is that we're looking at some new navigation system at the hospital and over at Williamson Medical Center. And so what that is that's a different way to place some of the hardware that we utilize while we're doing spine surgery to allow us to do more minimally invasive techniques and to more safely place some of the hardware that we're placing. And it's a really cool technology and really exciting that will put us kind of on the cutting edge of some of the technological advances there in the spine. The other thing would be outpatient spine. And so we're really have realized that it's safe and efficient and a very good option to perform outpatient spine surgeries. And so we're doing more and more of those, and we're just having great results, and patients have been very happy.
Awesome. And is that both over at Williamson Medical Center and downstairs in our surgery center?
Both. A lot of the outpatient stuff we're pushing over here to the surgery center just out of simplicity and efficiency, but we do a lot of outpatient surgery over at Williamson Medical Center, and they do a great job too. And patients, again, either place the outpatient component and getting people back and post-operative day 0, the day of surgery, them to be able to go back and sleep in their own bed and be at home in a comfortable environment makes a big difference.
Absolutely, absolutely. Well, Dr. Davidson, we ask this on each Facebook Live that we have with our physicians here, but how does the spine program and what you're able to do on a daily basis, how does that add to the comprehensiveness of Bone and Joint Institute?
I think it's a great opportunity, and we really cover a plethora, basically the gamut of orthopedic treatment options. And so, on a day-to-day basis, I'm collaborating with my spine partners, my hip surgery partners. I'm collaborating with some of our non-surgical spine care specialists, and routinely we'll walk down the hall and be able to talk with Dr. Zach Cobb, who's doing our injections, and ask him about injections and check on patients of mine that are getting injections. I can check with and refer over to Dr. Richard Gibson, who also does some injections, does some hip injections and some different ultrasound-guided injections. And if we have somebody who happens to end up in my clinic that really think that they are having predominantly hip pain, a lot of times we'll even get them over to talk with one of our hip surgeons that day if we can fit them into the schedule, and it really just makes from a collaborative standpoint, makes things so much more efficient and so much better for the patient overall. Excellent,
excellent. Well, Dr. Davidson, thank you for your time today. We know that you do have a busy clinic day, so we really appreciate the time that you set out to talk to our patients about this. So if you have any questions or want to schedule an appointment with Dr. Davidson, you can visit our website at boneandjointtn.org or give us a call at 615-791-2630. Dr. Davidson, thank you again. We appreciate it.
Absolutely.